At one point there was like a time where they're like, you've got so long to live or whatever. They said that to me, but they wanted to come in and tell me, even though my parents didn't want me to know, just in case. It frightened me, but they wanted to get in and tell you.
I don't want to be involved in any of the decisions. I would rather they make all the decisions because I wouldn't trust myself to make any of the decisions. They told me that it was leukemia, but they didn't tell me that it was cancer.
So when you're in Bristol, they'll explain everything where you'll not need one question. I didn't need to ask anything once they were done, like telling me everything that was going to happen. Whereas like when you're over here, they didn't really like explain much unless you asked them.
I don't want to be treated like a sick person. I'm not sick anymore.
Well, most of the nurses were very nice. They would come into your room and just like kind of talk to you. Some of them just would treat you normal and just have a laugh with you more or less, whereas doctors, I feel like they're a bit too serious.
But then there's the ones that come in and just be like, right, blood pressure, tablets, gone again.
I get that they're like working in a bad environment, like it's sad sometimes, maybe like not come in dead down when they're around a patient that's sick because they're down anyway. Maybe come in a bit more happy or upbeat and maybe make them feel a bit better.
Take some breaks, more breaks for them, like, because they're worked off their feet, the nurses.
Yeah.
Like, that's one thing I would say, they're definitely worked off their feet.
Some nurses they'll make sure what they're doing is okay with you, and then other ones will just plop straight down your bed without asking first.
Doctors don't have to be so upfront. They can maybe sugarcoat it a wee bit just so it's not as bad.
In between.
If they're limited on time and can't have a whole big discussion, then maybe
Leave it
drop
till
your
another time.
conversation on like, there are some side effects, but we can talk about that some other time, and just come back to it at a later point where you're like, you sort of gotten over it.
When I was like in Bristol, we were there for months and you weren't allowed people that were like 12 and younger. It didn't really make sense when parents were coming in and they were older and they could probably bring in germs the same as like a child can. So if they just do the same as what they're doing with the adults, then surely they should be able to come in.
Toys and stuff are mainly for younger ones.
Wi-Fi's the only thing that gets you on social media, and that's the only way to keep in contact, FaceTime your friends. Like, I didn't realise how important social media actually was until it was the only thing you had. Focus more on teenagers and what they would want.
But like sometimes when it's summer and it's like way too warm, there's like no air for you to actually like, being that warm doesn't help at all.
Put air conditionings in the rooms.
Oh yeah.
Make the children's ward up to 18 and not 14, because I had to get put into the adults ward for my diagnosis, and they don't really sugarcoat it at all because you're in the adults ward, so they just tell you it straight to your face as if you're an adult.
If you've been in children's hospital for so long and then have to go somewhere where it's like more serious and bigger with a lot more people, then it's a bit, daunting.
One thing I think we need to do is like transplants. They need to be able to do them over here in like Belfast or whatever, or somewhere closer.
When I was like changing from like children's hospital to the adults one, it was quite different because the adults like it's really like dark and dull, if you know what I mean.
When I had my first seizure, I was brought in by ambulance into the emergency bit, and there was loads of people there, and there was like people like drug addicts and like Dan, and it was like really scary for me. So it was. Like outside my ward, there was a room for us to go into, and like I was doing my maths GCSE at the time, so there was like loads of books and things on the walls to help you, like with algebra and stuff like that. So that was helpful. So I was in like children's service, I was in paediatric. And they didn't tell me anything about it whatsoever. They just handed me like a whole packet of booklets about it. And when I read them, when I went home, I didn't understand any of it because it held all these different words. I felt like when they were giving me information finally, they were talking to me like really childishly and like in a condescending tone. And it helped, like I really struggled accepting my condition because of that.
The staff, like they were really caring. They didn't judge me when I cried when I was getting needles.
The best thing for me was probably getting transferred from children's services to adult services because they were like much nicer to me. It was more like professional and they talked to me more, so they did, and explained things better to me, and I was included in all like decision making.
I would put more nurses on the ward.
If the hospital had like information cards on your condition and everything that comes with it, like to give to the schools so they understand.
Thank you. They helped me a lot.
Because like the other wards are like with children and like my age, and I was like kind of wondering why aren't I with my younger age? Like it would have helped me a lot if I was around people my own age.
A lot of health services will call you with no caller ID. A lot of people don't answer private numbers for obvious reasons.
I think having Wi-Fi in a waiting room would help a lot of the people that are waiting for their appointments, because it can help distract them from waiting and just sort of calm their nerves and give them something else to think about.
I think the support's mostly for parents. As a child, you don't really have much involvement with it really.
And sometimes the explanations can be a little bit jargony maybe. They speak as if they're speaking to another professional rather than speaking to maybe somebody like myself who wouldn't understand. If I don't understand something, sometimes Google's your best friend.
It's hard enough to start trusting somebody enough to talk about a lot of things, and it takes a little while to start opening up. So then having to start again with somebody new is pretty daunting.
I would prefer to receive information from a trained professional that I knew was a trained professional rather than Dr. Shivago on certain forums.
The letter I got confirming my appointment was from somebody else. Well, what does this mean? Am I seeing somebody else for a one-off thing, or is this permanent?
The only thing that I would say from CAMHS was, after my initial assessment, they seemed very set on one path, and they didn't maybe keep an open mind quite so much. Sometimes too, you do bring your parents with you to initial assessment with CAMHS. I'm not sure that's helpful when you're 16, 17, 18 maybe. They call it the child and adolescent, but you can clearly see that they've designed the waiting area much more for the child end. It makes you think that you're going to be treated like a child.
I don't have too many complaints about CAMHS, but
I didn't really get proper treatment until I attempted suicide, and then I was sent to CAMHS pretty much straight after I came out of hospital. I just want to say that after I was seen at CAMHS, it did help a lot, and I did get a lot of things cleared up, and it's helped me get to where I am now, so that was a positive experience.
Generally, everyone was really good. Generally, everyone kind of used my name, my pronouns. But there was just like a few people that would not, for example, use my name and pronouns. You could just tell that they thought this whole trans thing, they didn't understand. They thought it was a bit ridiculous, even though they were kind of trying to be nice and polite about it.
There's clinicians at COI asking 14, 15, 16-year-olds about their sex life, about how often they masturbate, about, the really, really invasive questions that...
I've been friends with many trans women and like trans feminine people, and the common experience is if your doctor doesn't ask you about your sex life, you're very lucky.
Sometimes a lot of personal opinions, especially on trans issues, might seep in to the way clinicians work, for example. That is something that I've noticed quite a bit with trans issues, is the personal opinions will seep in quite a bit.
Like, show up in a dress and full makeup and like be as girly as possible, and if you want to get through it and not be dropped and you want to get your hormones, just be as much of a stereotype as you can.
It feels less of like, okay, let's help you, and more of, let's see how you're not actually trans.
I feel like with the whole stereotypical image of trans men have to be super masculine, trans women have to be super feminine, there isn't really any room for non-binary people.
But when a trans person comes to you for help, ask, how can I help you? And then listen.